MRSA, UTIs, skin infections, GI infections. Doctors, there's so many. How are all these infections kind of changing the protocol of the ER?
Yeah, in the case, the problem with, for example, the one that you're talking about, MRSA, that's a bacteria that is called Staphylococcus aureus. And that bacteria is very common cause of infection in the skin and abscesses in the skin. Those people say, you know, they have like, people refer to them usually as an ingrowing hair, and really many times it's this bacteria that is having problem because it enters on the follicle of your hair. And then causes an inflammation there, and then you start having a redness and inflammatory changes there. So that's what we call, that's extremely common. I mean, I can see 2 or 3 patients every day with that.
Really?
And they need to be drained because they form an abscess, and you need to drain those abscesses, and then you provide antibiotics. The issue with MRSA particularly is that it's one of those bacteria that develop resistance. Staph aureus used to be sensitive to penicillin when penicillin first came. And in fact, penicillin was very useful in the Second War to treat Staph aureus because that was a common infection during the war, skin infection because of the wounds, etc.
But now,
and then became rapidly resistant to penicillin, and then we came with a different antibiotics and became rapidly so resistant as well. So basically, MRSA is a bacteria that is resistant to an antibiotic that is called methicillin, and we have to use alternative drugs that many times are not the best, as good as methicillin was or penicillin is. So that's one of the problems with this type of infection. So that's a classic one and very common one, and a bacteria that used to be common in the hospital. When you got in the past MRSA, it's because you had gone to the health system, to the hospital. What happened is that now that bacteria has translated to the community. So we see a ton of people who have never been to a hospital, young kids playing soccer, playing football, playing the, contact sports, professional football players, and they get this infection of the skin that can be devastating sometimes. That can kill a person if it's not taken care of well.